Hello and welcome to our incoming class. My name is Blair Brown and I am the Program Director of the Master of Science in Dietetic Internship program here at the University of Texas Medical Branch. This presentation is going to give you a brief overview of the supervised practice rotation opportunities that we offer here in our program. Before we get started, it might be helpful to print off this presentation or grab a pen and paper. That way you can take notes, star any rotations that interest you, or write down any questions. The goal of the internship is to not only prepare you to become a competent entry-level registered dietitian nutritionist, but it's also here to expose you to many areas of dietetics to give you a well-rounded experience. If you already know what areas of dietetic interest you, that's great. If you have no idea what you want to do as a dietitian, that's also great. That is what the internship is for. Prior to our meeting, please be sure to review this presentation. It's important to note that you must be signed up for a course to get credit for that course. You will be able to register for courses during orientation week in August, and you will automatically be enrolled in those courses in Blackboard upon registration. In our program, you get graduate course credit for completing supervised practice rotations. In our degree plan, we have 5 supervised practice courses for which you will receive course credit. These courses vary per credit hour, anywhere from 1 to 6 credit hours. You must complete at least 20 supervised practice credit hours to graduate. The 5 supervised practice courses include clinical, food service, community, selective specialty, and staff relief. The first supervised practice course I will talk about is clinical. Clinical rotations will be separated out into a clinical 1 rotation and clinical 2 rotations. Your clinical 1 rotation is anywhere from 6 to 8 weeks, or about 240 hours. This first rotation gets you used to the clinical setting, allows you to have opportunities to interact and build rapport with patients and interdisciplinary team members, become familiar with navigating the electronic medical record, learn how to use professional resources such as the Nutrition Care Manual and UpToDate. And this is also where you're going to learn how to construct nutrition care plan notes in the style of the rotation site. We offer a wide variety of hospital sites for our students to complete their clinical rotation. The idea of the clinical 1 rotation is to expose you to as many of the most common comorbidities that you might see on the inpatient side. Conditions such as diabetes, heart disease, oncology, GI issues, surgical issues, and trauma. At UTMB, we have campuses in Galveston, League City, Clear Lake, and Angleton. We also have affiliations with HCA, Clear Lake, Mainland, and Southeast. Students may also complete clinical 1 rotations at Houston Methodist Baytown, Tier Memorial Hermann, and Oak Bend Medical Center. For all supervised practice rotations, the program director will assign you to the rotation site. Most of the sites are local or within a 50-mile radius of the Galveston campus. Most likely, you are going to complete your clinical 1 rotation and hospital food service rotation at the same rotation site. This allows for continuity as you've already been cleared to work at the site, such as your clearance paperwork and your background checks are already completed. It also allows you to become familiar with the site. You'll know both the clinical side as well as the dining system, so everything blends together. You may complete them in any order, such as hospital food service might come first and then your clinical rotation, or vice versa. It's important to note that all students will be expected to purchase a short white lab coat, one that hits right at the hips, to be worn at clinical rotations, unless otherwise instructed by your preceptor. Some of our clinical sites do wear scrubs, such as the UTMB Galveston campus. However, students are not required to purchase scrubs, as business casual and a lab coat will be sufficient. Lab coats can be purchased from the UTMB bookstore for about $35. After you have completed your clinical 1 rotation or your general inpatient clinical rotation, students move on to what we call clinical 2 rotations. This could consist of 1 or 2 additional sites that you go to for about 3-4 weeks. Some sites do require that students be there for a total of 6 weeks, but usually it's about 200 hours accrued during this time frame. These are your more specialized rotations, whether on the inpatient side, outpatient setting, or long-term care. These rotations will expose you to unique patient conditions and procedures and allow you opportunities to round with multi-interdisciplinary team members, gain one-on-one training and career advice from higher skilled dietitians, and advanced training for future jobs. Here at UTMB, we offer a variety of clinical 2 rotation sites such as inpatient renal and chronic home dialysis, solid organ transplant, the Stark Diabetes Clinic, pediatric endocrinology, pediatric complex care, inborn errors of metabolism, the pediatric GI clinic, and the neonatal intensive care unit. I'm going to go into a little more detail about some of the clinical 2 rotation sites offered through UTMB. The inpatient renal and chronic home dialysis clinic is a mix of both inpatient and outpatient work. You will work closely with the renal dietitians, learn about the various diet modifications, treatments, and medications related to hemodialysis, continuous renal replacement therapy, and/or peritoneal dialysis. You'll practice empathy when counseling patients and learn about other related comorbidities. If you are interested in completing a rotation with the solid organ transplant team, it is highly recommended that you complete a renal rotation prior to the transplant rotation. Another rotation site is our solid organ transplant rotation. A fun fact about me is that I was the transplant dietitian for about 8 years prior to taking on the role as the MSDI program director. In the organ transplant rotation, you will experience kidney, liver, and heart transplantation. You'll work closely and round daily with the transplant interdisciplinary team, participate in meetings where decisions are made, counsel and follow up patients in the outpatient setting, and have other special opportunities such as going to the OR to see a transplant surgery be performed. The Stark Diabetes Clinic at UTMB is located in Lake City. At this rotation, you will gain a lot of experience providing counseling and education to those with prediabetes, type 1, type 2, or gestational diabetes. The dietitian on site is a certified diabetes educator, so she is very familiar with insulin pumps, insulin types, and other glucose management medications. There will be some opportunities to provide group education classes as well. Of note, a good bit of the patients seen in this clinic are Spanish speaking. Another rotation site is the Pediatric Endocrinology Clinic that's located in the Clear Lake, Lake City area. At this clinic, students counsel patients and their families on how to manage blood sugars and incorporate positive diet modifications into their lifestyles. The Pediatric Complex Care Clinic is for infants, toddlers, and young children who have a high malnutrition risk or special needs. Students work closely with the dietitian, gain familiarity with various pediatric enteral and supplemental formulas, learn how to work with families, counsel parents, and deal with various social issues. Students usually split their time between both the Complex Care Clinic and the Pediatric Endocrinology Clinic for a total of 4 weeks. Inborn errors of metabolism is another rotation that is often split between UTMB and the UT Health Science Center Pediatric Metabolics Clinic in downtown Houston. Students gain experience to various genetic disorders, work with genetic counselors, counsel families, and learn about highly specialized enteral products and diet modifications for these disorders. They also work closely with the close-knit interdisciplinary team. The Pediatric Gastroenterology Clinic is a clinic that offers services for children ranging from infants to young adults with disorders of the digestive system, including recurrent abdominal pain, reflux, feeding disorders, liver disease, constipation, vomiting, failure to thrive, celiac disease, and short gut syndrome. Students will work with the interdisciplinary team to provide counseling and education to patients and their caregivers. UTMB is one of 22 Level 4 designated neonatal intensive care units in Texas. This is the highest level of designation in care for critically ill, complex newborns and infants. Here, students will work closely with skilled dietitians and interdisciplinary team members to provide nutrition support recommendations for this tiny population. Other popular clinical 2 rotation sites offered in our program are Texas Children's Hospital. They require a minimum of 6 weeks, and it's located in the Texas Medical Center. Students are required to attend an orientation either in January or August, depending on when their rotation falls. MD Anderson Cancer Center and the Texas Medical Center downtown Houston also requires a 6-week rotation, and they take 1, maybe 2 of our students every year. The UT Health Science Center, the Pediatric Metabolics and Genetics Clinic I mentioned earlier, is paired with our Inborn Errors of Metabolism Clinic here at UTMB. We also have affiliations with the Memorial Hermann Pediatric Cardiovascular ICU. Shriners Burn Hospital for Children is right across the street from our Galveston campus. The HCA Clear Lake campus also has a high-level NICU that students can rotate at. We work closely with DaVita Dialysis Centers, the Center for Discovery, which is both inpatient and outpatient eating disorders, and Houston Methodist Baytown offers inpatient and outpatient diabetes services as well. Foodservice is the next supervised practice course we will discuss. Each student is offered the opportunity to experience both hospital and school food service as scheduling allows. Some students choose to spend more time at one rotation over the other based on their experience. For example, if a student has been working as a diet tech or a DTR in the hospital food service system for quite some time prior to entering their internship, they may choose to want to spend more time in school food service. Students usually complete their hospital food service at the same facility that they complete their Clinical 1 rotation, or vice versa, as mentioned earlier. School food service can be completed at any of our area school districts such as Galveston ISD, Dickinson ISD, Clear Creek ISD, Houston ISD, and Harris County Head Start. Community supervised practice rotations range anywhere from 3 to 4 weeks per site, or about 100 hours per site. And this gives the students the opportunity to work with dietitians who work in the community, learn about other resources, grants, and funding available for their programs, engage with different community members, whether adults or children, and provide education. Here is just some of our list of community rotations we offer, though it is not a complete list. UTMB has some local WIC sites in League City, Pearland, and Stafford. We also work closely with the Galveston County and Houston Food Banks. Galveston has a unique experience called Galveston's Own Farmers Market, where our students help run the farmers market on the weekends, as well as their Young Gardeners program. We also have affiliations with the Harris County AgriLife Extension Office. The UTMB Osher Lifelong Learning Institute is a facility here on campus that provides continuing education to older adults. We work closely with several private practice dietitians, those ranging in social media, pediatrics, just to name a few of their specialties. For those of you not from Texas, HEB is one of the largest grocery store chains in the state, and they have their own dietitians for which our students can work with as well. Orthotech is a durable medical equipment company, or a DME company, that students rotate with. UTMB has a unique experience because we are partnered with the Texas Department of Criminal Justice, and believe it or not, there is a dietitian who works in their outpatient clinic, and this is north of Houston. So if you live north of town, this might be a cool rotation opportunity for you all. And also unique to our program is St. Vincent's House. This is a nonprofit that UTMB has a close partnership with, for which our department is managing their community garden and helping with their food pantry, as well as the student-run clinic. The selective specialty course can be made up of 1 or more rotation sites, And this is an opportunity for you to rotate at any of our approved rotation sites and to get you the opportunity to really hone in on a particular interest level, interest area of dietetics that you might be interested in, or get to experience a whole new area from which you may not have been previously exposed to. Think of it like an elective course. This supervised practice course is also where all of the research rotation falls. Students are highly encouraged to complete a research rotation with one of our faculty members or approved sites. Some of the most popular selective specialty rotation sites that students often pick from are DeVita, NASA Johnson Space Center, the Memorial Hermann Ironman Sports Clinic, and then as well as our various research rotations such as the Seeley Center on Aging, or working with any of our faculty members on their ongoing research projects, either in metabolism, muscle adaptation, or behavior change. Rotations are also offered at Tier Memorial Hermann, which is a world-renowned facility that specializes in brain and spinal cord injuries. Our last supervised practice course is staff relief, and this rotation is usually anywhere from 2 to 3 weeks, or about 80 hours worth, and it's going to be completed at any of the supervised practice sites for which you have previously visited or worked at. It's important to note that it's up to the preceptor as to whether or not you'll be allowed to go back to the site to complete your staff relief rotation. So it's always important to make sure you leave a good impression, be professional, and make those connections. However, sometimes preceptors aren't available to accommodate you back just due to logistics or timing, so it's always important to keep an open mind and be flexible. Now, this was a quick rundown, but not an exhaustive list of our rotation sites. However, if you have any questions, be sure to write them down so we can discuss them during our upcoming meeting. I look forward to chatting with you and can't wait to hear what you're interested in. Thank you.